Okay, so hello everyone. Once again, I am joined by a topper from Marrow SS, and this is Dr. Pradeepti Prabhakar for all of you. She is AML and CML rank 1. And how are you feeling, Pradeepti? Many, many congratulations.
Thank you so much, ma'am. I'm extremely happy and still in shock with the result. I didn't expect this result at all, frankly.
I'm sure that, and lot of hard work has now, culminated in a very nice way for you, isn't it?
Yes, ma'am, I believe so.
So, Dr. Pradeepti has done her MBBS from Lady Harding and MS from Maulana Azad Medical College in New Delhi. And now she's going to pursue her plastic surgery MCH in AIMS, New Delhi. So, it's a familiar, feeling for you, I think, being around Delhi all your education career, isn't it?
I think struck the Holy Trinity.
Oh, yes. Oh, such a nice way to say that. Absolutely, I'm sure that you have. And so, tell us, Pradipti, what about? I mean, when did you do your MS, and how did you think about plastic surgery? When did you start preparing?
Ma'am, I belong to the MS batch of 2020-23, and I
Okay.
passed out MS in the year 2023. And
Okay.
initially, I was not very sure about the branches because in my during post graduation year, I didn't have much exposure of other
Yeah.
branches. We were the
Right.
COVID batch, so we
Mm,
didn't get any rotation in any super specialty branches. So we didn't
mm,
have any exposure.
mm.
And plastic surgery came to me because I love artwork, and this
Mm.
is what exactly I said in my interview round also, that I love artwork, and I think there are a lot of similarities that can be drawn between art and plastic surgery. They both go on same principle. So
Yes.
I just started reading plastic surgery out of interest, and as
Mm,
I read plastic surgery more and more, my interest developed more and more, and I saw that it is such a wide branch, covers everything from head to toe, and there's so
mm,
much to do. There's so much scope in the future. You can choose anything to do after plastic surgery. So that's
mm.
why my interest developed in plastic surgery from here. I think that's the main reason.
So that's very well put. And while we are at it, I'll just show you something interesting. So that is a painting that I did some 2 years back that you see behind me. So
That's so
uh,
beautiful, ma'am.
I'm not a great painter though, but yeah, as in
I would
it's
disagree on this. I can see the painting.
so it's a nice way to spend time. But yeah, I mean it's great that you draw that parallel. And yes, I indeed agree with you that plastic surgery is such a wide branch that it covers from head to toe, as you rightly
Yes,
put.
ma'am.
And it's such a problem solving specialty, as we call it.
Yes, ma'am.
So, so when you did your MS, Pradipti, so I mean, when did you start preparing seriously for plastic surgery?
Ma'am, after my exams, actually, I was in a bit of party mode, so I didn't study for almost 3-4 months after my MS exams. Once I left my post graduation, then it struck me that I should start studying,
Start
and
doing something.
this INI will be my first attempt. I just took it as my first attempt. So
Oh,
I started preparing seriously in June 2024 of this year. So
okay.
I started studying in June, and that's it, ma'am. From June to October, that has been my preparation period. That
Okay.
that's
So
it.
that means that you've not worked in plastic surgery before.
No, I have not worked in plastic surgery. I have no experience in this department at all. I've seen one or two cases maybe in my general surgery days. Otherwise, I have no experience in this field.
Okay. So that's what I tell, when they ask me to hold the, pre-preparatory sessions, and I tell everyone that, don't be scared about not being selected because you've not worked in plastic surgery before, because you're a fresher, all these things. I think the examiners are much wiser than that. And if they had to select people only from who have plastic surgery exposure and experience previously, then it is a no brainer that freshers should always not think that they will be selected. But it's not like that. And you've again yet again proved it, that even though you don't have any previous plastic surgery exposure, you have an equal chance of being selected in these entrance exams. So now you tell me that once you decided, did you lay out a plan for yourself that, okay, I'm going to do things this way or that way? And how did you decide and what did you do?
So, ma'am, initially, I think my plan was to, I had the Marrow subscription because even for the MS exams, I had studied entirely from Marrow. I studied
Okay.
the gastro and Euro sections for my degree exam. So I had
Hmm.
Marrow subscription and I knew all the videos because I had watched few videos earlier just for
Right.
seeing my interest in plastic surgery, and I found the videos very good. So my
Okay.
plan was to just watch videos and see what can I do with the exam. But I
Hmm.
realized that I was having very difficulty in grasping the concepts of plastic
Hmm.
surgery. The plastic surgery portion was okay in understanding, but
Hmm.
the rest of the portion, the head and neck, I found it very
Hmm.
difficult. Head and neck and then upper limb, I found it difficult. So
Hmm.
I planned that I'll just give one reading of Grab and Smith, especially of
Yes.
head and neck and upper
Hmm.
limb. So my
Hmm.
initial strategy was for first 2 months, I will give a reading of Grab and Smith of the sections which I find difficult, so that I have some basic concepts to
Basic.
grasp
Yeah.
upon.
Yeah.
So I first 2 months I had read Gavin Smith, head and neck and aesthetics and upper limb,
Hmm.
these three portions. And I think from September, August, mid August till October, I
Hmm.
had watched all of your videos almost 4 to 5 times, and that
Hmm.
was it for my preparation, along with some portions of Michigan Manual. I
Yeah.
referred Michigan
That's a
Manual
very
as well.
useful book. I have
Yes,
told earlier
that's a
also
very
that it's a
useful book,
very
ma'am.
useful
Just it
book.
has a very good structure and layout for the topics.
Yes, yes, yes. And I've included a lot of points from there also in my videos. So,
Yes,
um, I mean, if you have to put a percentage to it, how much percentage of your preparation was only from the Marrow videos? What would you think?
especially for plastic surgery, ma'am, I think 80%.
Okay.
Because I just took up Grab and Smith just for like reading a novel. I just took up it for reading. I didn't because I realized that if I continue reading this, I'll not be able to reach exam and I'll not be able to memorize anything from there
Right,
during the
right.
last days. So
Hmm.
from September onwards, I was just watching your videos like movie. Just kept watching videos till I memorized all the facts, whatever you
Oh
had
my
said.
God.
So
Yeah,
even I
4 to 5
remember.
times. It's like a lot of effort you
Yes,
need
I
to give
just watched it
day.
at initially I was watching at 1.5 times, and by the last I was watching at 2.5 times speed just to memorize what you're saying. And I remember specifically during my exam when I was solving the MCQ, there were a lot of questions which came up on the screen, and I could hear your voice saying that this is the answer.
Oh
The
my God.
questions were so similar to the Marrow videos which you had put on. So I
Okay.
can just remember that exam very well, all the videos very well. I think there are 2, 3 questions which are still in my mind, I think, of the while solving the exam, I think.
Oh, the
So
first,
I think I'll
the
just
step
80 to
one, step one
85%.
you're talking about, huh?
Sorry,
The
ma'am?
step one you're talking about, the step one of
The
the
step one, yes, yes, the MCQ part.
Okay, okay, okay. So, I mean, yeah, it's so heartening to hear that, and we've put a lot of effort in, researching about the topics and making PPTs. The Marrow team, is all the way with us, and we do. I mean, the editing and all. It comes back to us. We re-edit. We verify facts again. Then I go and record. Then they edit. So, a lot of background work goes in making those lectures, and I'm so happy to know that with people like you, that it really helps you in that in the preparation. But of course, strategies are different from for everyone,
Yes,
and
ma'am.
how much you retain from that is also an individual capacity. That a lot of people, they always go back to books and they feel more comfortable doing that. That is
Yes,
also
ma'am.
a good strategy. Of course, there's nothing to replace books, and we all know that.
Yes,
But
ma'am.
when there's time crunch and you want to make the best use and you have a target in mind, so I think there the videos come to
Yes, ma'am.
good help. So tell me, what about the second stage? I mean, were you nervous?
A lot. Because like you said, I was a fresher, so I already had very low hopes because I didn't know any procedure. And the first question, there were five stations, the five round of vivas, and in each of them, the first question they asked was, "What is your experience in plastic surgery?" And I used to say I had zero experience, and they used to stop there, and then used to think that
Okay,
what can
what
I
should we
ask
ask?
her? So they used to think a lot, and then they just got back to very basic theory questions. They didn't ask me anything, nothing about surgeries or the procedures. They didn't ask me anything. They just asked me very basic theory questions in the stage two.
So what were you asked in the different stations?
So, ma'am, there were five stations,
Hmm.
including the one with HOD sir. The
Hmm.
one with HOD sir was a very formal interview. He just asked about the academic achievements and why you chose plastic surgery. So that was
Hmm.
it with him. In the
Hmm.
rest four, there was nothing specific planned, I think.
Hmm.
They were just asking random questions based on the candidate who was appearing. So, like I
Hmm.
said, they asked me, what is your experience and what have you seen in your general surgery days? So I
Hmm.
told them that I've seen a rotational flap, etc., like this, or they asked me whether you have seen burns patients. So they were not asking me even question on burns if I have not seen a burn patient. So they
Hmm.
asked
So they
me
first
questions on
ask you
flap.
if you've seen. Yeah.
Yeah, they only asked the question things which I've seen, except
Hmm.
in one viva, which I'll
Hmm.
come to. So the most common questions which they've asked me was based on flaps, the
Hmm.
classification, math is the high classification of flap. Then they asked me a lot of questions. I think even in in the first stage and in the
Hmm.
second stage, the
Hmm.
scalp is a very common part
Hmm.
which they ask. They have
Hmm.
asked a lot of questions on scalp reconstruction in all
Hmm.
the vivas. I
Hmm.
think
Hmm.
basically that is also because I said because I've seen a rotational flap of scalp.
Additional
So
flap.
that's the
Yeah,
reason
yeah,
why.
yeah. And the scalp is where it's most commonly used.
Yes. And
Hmm.
then they tried to ask me on the traumatic injuries of hand, but just
Okay.
because I didn't see any case, so they didn't ask me anything further.
Hmm.
Then there was one question which was very common in all interviews was uh, if you know anything about any famous plastic surgeon and what are their contributions to the field. And
Hmm.
second most common question was on CK Balakrishnan sir and what is his contribution to the field.
Hmm.
So these two questions were very common.
Hmm.
And then there was one viva in which ma'am had asked me, which is the most famous journal of plastic surgery, and have you
Hmm.
seen it?
So
So
what
I
did
was,
you answer?
I couldn't answer that.
Okay, okay, okay.
I didn't expect that they will ask me because
Yeah, I
the
am
space
sure that they
is
were wanting to
entirely
hear the
different.
PRS, it's the Plastic and Reconstructive Surgery Journal. So
Yes, ma'am.
so
And then there was one viva which was quite elaborate in which sir was asking a lot. So he had
hmm.
asked me almost everything from flap to scalp, and then he went on to aesthetics and he asked me a lot on Botox. And he asked
Oh,
me the Botox.
okay.
There were a lot of questions. He just kept asking Botox for almost 4 to 5 minutes, and
Really?
yeah, yes, ma'am. So
Okay.
and he asked me what are the other uses of Botox.
Hmm.
Excluding plastic surgery, where all can you use it, the botulinum toxin and all.
Hmm. Hmm.
And these were the questions, ma'am, pretty much all.
Okay. So it's Botox that got you your seat.
I'm not sure.
Okay, no, no, that was in a lighter vein. So that means flaps, scalp reconstruction,
Scalp reconstruction.
then you
Burns,
said
ma'am. Burns was also a common
burns,
question.
burns, yeah,
The traumatic
hand
injuries of
trauma, hand,
hand
yeah,
trauma, and
right,
the aesthetics.
yeah. So
These are
did you attend the Zoom session that we did previous to the second stage? We
no,
had
ma'am.
done a session.
Actually,
You didn't. Okay,
no,
okay, okay.
couldn't attend. I couldn't find it on time actually. So I
Okay,
was
okay.
looking for it, but I
Yeah,
couldn't
so
find
there, like, usually before the second stage, we have this session which the Marrow organizes. And there I run through the topics that which are most important because there are only 4 or 5 days left. And generally, people don't have time. They're panicking. Okay, what to leave, what to study. So I have a list where, I run them down, on the list and I tell them that, okay, don't read this, just forget about this. You must do this, so all that. But yes, burns, definitely maxillofacial trauma, hand injuries,
it.
this is all a part of the must do list, the flaps classification and all. So it's
Classification.
it's a must do. So yeah, so when are you joining?
Uh, When I mean, I think ma'am, it depends on the counseling, the
No,
joining.
I think January, I think the
It
session would
should
be,
start by
right?
January, ma'am, but I think the results are delayed this time by at least 20,
Oh,
25 days. So
right,
last time the results came out on 22nd November. I think this time it got delayed due to some reason. So I'm not
right.
sure when is the actual joining date.
Right, right, right. Also, Praditi, I would like to hear from you the five most important things, according to you, when somebody has decided to prepare for plastic surgery entrance. So, what would you keep as your five most important takeaway points for the benefit of people who are wanting to prepare?
I think I can answer this, ma'am, only as a fresher, I think, right
Hmm.
now.
Not a
So
problem.
if you
Yeah.
are a fresher, uh, I would say that you take a break. if you want to prepare for INI, 4 to 5 months are good enough. I think I've realized that right now. That if you sit for 4 to 5 months, you can do it well.
Mm,
Uh, it's your choice that you can join somewhere,
mm,
because that will be a very common question in the stage two. They will keep asking you every time if you have an experience, and that I
yes.
think that carries an importance. With me,
Mm,
I think I had scored well in theory, so that got me covered. If I had
mm,
scored well in theory, I would have flumbered a bit. So I think
true.
the first important thing is to realize that you can take a break in life
Mm,
to prepare
mm,
for an exam. So there's
mm,
no rush. The second important thing is you need to realize that we don't study much plastic surgery in our MS days. So we
mm,
don't have any basic concept. We have not seen any cases. So
mm,
you'll need to read Graben Smith once, at least of the topics which are a bit difficult for our level, like head and neck,
right.
maxillofacial, and upper limb, and
Mm,
aesthetics. We have not seen the cases. So you
yes.
need to read that once. You cannot skip that part. You need to read the book once to grasp the concepts. I think that is the second important thing. The third I would say is to always take help of your videos. I have seen it like a movie, so I think I would advise everyone that you don't need to look anywhere. I think you can make it your center point and you can plan everything around it, because
Okay.
you have explained everything in a very conceptual way. So you don't need to do anything apart from that. For especially for stage one, even for stage two, you don't need to do anything except for Marrow videos. That will cover most of the important things once you have grasped your concept from Graben Smith.
Mm,
The fourth thing I would say that if you want one more book and a bit structured book, you can go for Michigan Manual. And I think the fifth important part is, ma'am, you need to realize that there's a difference between stage one and stage two preparation. This was where I was lacking. I didn't have much idea on how stage two looks like. So when my
mm,
interview started, I was in a bit of shock that this is how it is going. What the
mm,
questions they were asking, I didn't expect. I prepared theory, even the
yeah.
10 days gap. I kept
Mm,
preparing theory a lot, but didn't
mm,
ask me anything. If
anything
I hadn't prepared, it wouldn't
mm,
have mattered at all. So you
at
need to
all.
realize that stage two is a bit different, and you need to
Mm,
prepare it a bit clinical way. You need to
mm,
prepare it in a way where you can tell about the approaches.
right.
So that is important. I think that's all, ma'am. I think that is
And how
there's
many
not
times
much.
did you revise, and what is your take on revisions?
Ma'am, like I said, I've just read Gavin Smith once. I had revised Michigan Manual. I think two-thirds of Michigan Manual. I think 2 to 3 times I've revised it, and
Mhm.
your videos I've watched at least 4 to 5 times. That I can say confidently.
But definitely,
Especially
the
the
revision is a very important part
I think
of
revision is the most. The frequency of revision should be more.
more.
You
Yeah.
shouldn't watch it in a very comprehensive way. You should just watch it a lot of times so that it gets registered in your memory.
Yeah.
So I think the frequency of revision should be quick and should be a lot
Mm,
right before exams. I think
mm.
that is the key.
Yeah. So, what are your, I mean, did you find that right cause of what is your drive to become a plastic surgeon now, apart from the art side? Now that you know the branch a little more.
I think, ma'am, I just want, uh, I'm still not sure, but I think I'd like to focus on the head and neck. That is my area of interest, and especially
Interesting.
the face. So I
Mm,
really like all the facial reconstruction, the ear reconstruction, the nose reconstruction. Those are the parts that I'm really interested in. The lip reconstruction. Those are extremely beautiful topics, and I
mm.
think these are very beautiful, and that will be, I think, my area of interest in future. I think so.
Okay, so I mean, it's really a pleasure talking to you, and it's so heartening to see a fresher get through, not only get through, but get through so well. I mean, rank one is, I mean, you can't get better. So obviously, and I'm so proud of you that you've made very good use of my hard work, and I'm sure that there are many others who've qualified from our student list. But it's such a pleasure talking to you, Pradeepti. And just for your information, tomorrow I'm going to go to AIMS New Delhi. There is an aesthetic surgery update, and I have a lecture on deep plane facelift, which I'm going to deliver tomorrow in the morning. So, very nice and welcome to the gang. And I hope that you
Thank you so much,
enjoy
ma'am.
this branch and you make it your own. That's very important to own what you do. So I think I absolutely love what I do, and it's such a wide specialty that you can't
Yes,
do
ma'am.
everything. See, there are very talented plastic surgeons who are doing everything, and they're doing it so well. But yeah, I mean, my focus is aesthetic surgery. I do get a reasonable amount of reconstructions also, which I do. But great, and I'm sure that the journey is going to be very, very exciting for you.
Hopefully, ma'am. But
So
before we end, ma'am, I'd just like to say for everyone that I think if you want to excel in plastic surgery, and especially in I&I, they should just watch your videos. And like I said before, this is just a celebrity moment for me. I was watching. I was watching you for the past 6 months, and now I'm watching you live. So that is for me. That is it for me. So
thank you. We'll meet in person
I'm
soon,
extremely
very soon.
grateful to you, ma'am, for making such videos. I'm really extremely grateful, and thank you from the bottom of my heart. Really,
No,
thank you.
it's my pleasure. Totally, it's my pleasure, and I'm so happy that I get the opportunity to meet young and bright minds like you, and it keeps the fire burning within me that I have to do better at the lectures. So also one more thing, I just before we part, I would want to ask that did you answer the NEET SS also?
No, ma'am, I've not appeared. This was just my first exam of super
The
specialty,
first
and
attempt
then
and
first exam, first attempt. And
first
I
and the
started
last
preparing
test.
for NEET SS just 3 days back for my next. So I'm really grateful the results came out and I had to stop studying.
Yeah, so no, so well done. I'm extremely proud of you, and I'm sure the entire Marrow team is. So I extend my congratulations to you from the Marrow team and from my side also. And enjoy your days before the things get busy, and it's going to get super busy, I'm telling you.
Yes, ma'am.
So enjoy your time and take a break. So thank you for joining us, Pradeepti. It's been a
Thank
pleasure
you so
talking.
much, ma'am. Thank you so
Thank
much, ma'am.
you. Thank you.